Thanks for tuning in to the Mission Matters podcast, where we feature successful, mission-driven leaders committed to creating a positive change in the world. Our mission with this channel is to inspire other leaders by providing industry insights, new ideas, and inspiring stories from the pros.
All right. Hello, I'm Paul Fyth, host of this show where I talk with leaders heading up mission-focused or purpose-driven. We can add that in there. Organizations leading from the heart, inspiring others, and making a difference in their communities. I have with us Karen Murphy of DuPage Health Coalition. She's an experienced leader with a demonstrated history, I'm just reading this from her LinkedIn profile, of working in the hospital and healthcare industry. She's now the president of the DuPage Health Coalition. I say now she's the president, but she's been the president for quite a while now. So, Karen, thank you so much for being part of the show.
Thanks for having me, Paul.
Yeah. So what is it now? Are we celebrating somewhere around 20 years now?
I have been with the Health Coalition for the better part of 20 years. It'll be 20 years this fall, although I did step away briefly in 2015. I've actually only worked for two organizations effectively in my entire adult career. I started my career at Central DuPage Hospital, which is now Northwestern Medicine. Had a wonderful experience working there and sort of cut my teeth in healthcare. Moved over to the DuPage Health Coalition, which was then called Access DuPage in 2004. Left briefly, returned to Northwestern for about a year, and then boomeranged back to DuPage Health Coalition because, in all sincerity, it is just a job that fits me as perfectly as a job can, and I missed it more than I expected.
Oh, wow. Well, we're going to unpack that in just a bit. So 20 years in this organization in an industry where, typically the president or executive director is 5 to 7 years. But I want to go over first, what are all the services of Access DuPage? Because DuPage is in the name, right? So to me, it's already like a countywide initiative.
It is.
Right?
And that's accurate. Our focus is countywide. If you go back when our program first started, DuPage Health Coalition started in 2001. I joined in 2004. So I was not there at the very beginning. But really, the mission of the DuPage Health Coalition is to build an efficient and effective health safety net for our low-income, uninsured, and underinsured DuPage County residents. And back in 2001, there were a lot of people who were uninsured here in DuPage County and nationally. We didn't have the Affordable Care Act. And we had a growing number of low-income, uninsured residents of the community. And we didn't have a mechanism by which to provide them access to comprehensive, high-quality health care. You look at the city of Chicago, there's a Stroger Cook County Hospital. There were federally qualified health centers, safety net health clinics. We didn't have any of that. But what we had was a really rich array of assets and resources in the community. We had a really robust healthcare system comprised of high-quality hospitals, medical groups, lots of excellent physicians and providers. And so what we believed was that we could create sort of a hyper-local approach to addressing the needs of the patients who were uninsured and income limited. And Access DuPage, our first program, was built out of that idea. Really thinking about all of the services that you or I or anyone else would depend on being able to access: primary care, specialty care, hospital services, prescription medications, and trying to create a method and a system by which patients who didn't have insurance and didn't have a pathway to insurance could still access all of those services. Heavily dependent on volunteers, heavily dependent on our health system partners. The name DuPage Health Coalition isn't an accident. It really is a coalition that makes this possible. Every hospital in DuPage County contributes financially to ensuring the success of our programs, as well as partnering to open the doors to health access for the patients that we serve. So Access DuPage is our oldest and longest running program. We've had 75,000 patients that have been enrolled in Access DuPage since we began. And when patients are enrolled in Access DuPage, they are able to access a pretty comprehensive set of health services, much like those of us who have insurance, at low cost, either no cost or with modest co-payments. And our goal is really to create generous access to the most effective parts of the healthcare system, like primary care and medication, so that people are able to stay healthy. The value proposition for our health partners and others is that the truth is, if people don't have access to healthcare, they end up through no fault of their own using the health system ineffectively, inefficiently, because they don't have any choice. And so we really recognize that if you give people those tools, they want, just like the rest of us, to be able to be healthy and care for themselves and their families. And we think that's within our grasp here in DuPage County. Separate from our Access DuPage program, we have a host of other programs that evolved over time. Once the Affordable Care Act was in effect in 2014, 2015, there were fewer patients who were uninsured, although there are still patients who need care through the program of Access DuPage. Prior to the ACA, we were serving up to 15,000 patients a year in that program. And today it's more likely to be about 6,000 patients. So that program remains foundational. It's still a very big piece of what we do, but we've also been able to spin up some other services and resources that are helpful to the patient population that we serve. We have a program called Silver Access, which is an ACA premium assistance program. This is a way to help people to be able to purchase higher quality health insurance. What we were finding post-ACA is that a lot of those patients who transitioned out of Access DuPage were staying uninsured. They qualified for health insurance, but they didn't feel like they could afford the health insurance they qualified for. Or they were choosing plans that had high out-of-pocket costs. And if your income is very low, those high out-of-pocket costs are crippling. You don't really have access to care under that circumstance. So what we do is we help to make it easier for people to purchase really good health insurance plans that they can use in the way that they were designed and intended to be used. So that maybe their primary care visits are free, maybe their generic medications are at no cost or very low cost. And so they really do have meaningful access.
Wow. I mean, it's a broad range of services.
Yeah.
A lot of people, when they think of DuPage County, though, think it's a very rich, diverse county, wealthy. When I say
it
rich.
is. I mean, on balance, my predecessor at the Health Coalition used to say, if your head is in the oven and your feet are in the freezer, on balance, you're very comfortable.
Right.
Which of course is another way to say that this is a relatively affluent community. On balance, in aggregate, our median household income here in DuPage County is relatively high, but we have tens of thousands of low-income families, actually
Yes.
probably north of 65,000 low-income uninsured families here in DuPage County that need services like those that we offer, because we're the second largest county in the state of Illinois. So even though many folks are doing relatively well, just because we're so populous, there's also a significant number of folks who continue to struggle.
Which we know, because what I'm heartened with is services like yours and other nonprofits in DuPage County that make it what it is, that helps the ones that aren't so affluent and the ones that are uninsured, the ones that have a lower income status. So the more I talk with leaders in the nonprofit world, especially in DuPage County, which is so rich with, I forget the latest numbers, something like 3,600 nonprofit organizations.
Nonprofits, yeah, I think I know that it's north of 3,000, and many of them, of course, focused on DuPage, but not exclusively. Lots of national nonprofits that also find their home here. I think that DuPage is unique in our culture of collaboration, and I really think that's actually the secret to how many of our community organizations both survive and thrive, and it also, I think, is to the benefit of our neighbors. What we've really learned is that we can be far more effective when we work in partnership. And whether it's an organization like the DuPage Health Coalition or our collective impact efforts through Impact DuPage, HEART, which is the DuPage Health Equity and Access Response Team that's really intended to address some of those drivers of health that continue to cause disproportionately poor health outcomes for some of our neighbors. Collaboration is as a colleague used to tell me, an unnatural act. It's not easy to collaborate, but the truth is that most of the easy problems have already been solved, and the hard problems probably require a collaborative approach to get some real traction and impact.
Yeah, I don't think I know a nonprofit organization that is not using some sort of collaborative model, right? They're not an island unto themselves.
No, well, among other things, most of us are constantly working to ensure that we have the resources to sustain our mission. And oftentimes collaboration is the most effective way to use those resources wisely, to be good stewards of those resources.
Sounds like a very truth statement spoken by somebody with 20 years experience.
Yeah, right. Well, and also grateful that that when you invite that kind of collaborative spirit, that's sort of where the magic happens. Better ideas come through that effort. Advances in resources. I mean, we couldn't do a fraction of what we do if we didn't have the partners that we have. And many of those partners notably have been a part of the Health Coalition from the very beginning, from the very first day that we opened. And, almost 25 years later, continue to be active and engaged. And honestly, oftentimes the source of the new ideas that we're just trying to listen to what the community needs, trying to listen to what our healthcare partners are identifying as gaps, and then working to fill those gaps with programs that can really make people's lives easier and better.
Nice. And you were saying earlier, just to go back to this one story, you left the DuPage Health Coalition for a brief period, a year or so.
I did.
Tell us about that and what led to that decision.
Well, I mean, in all sincerity, my first 10 years or so with the Health Coalition were under its founding leader, a real visionary named Dick Endress, and Dick had been a vice president of a hospital. He had a really innovative way of thinking about systems and creating models of care. And I thought that I worked very effectively as his second in command, if you will. But when he decided to retire, it wasn't clear to me that I would be as effective as a leader as he had been. And if I wasn't sure that I could do it well, I wasn't necessarily enthusiastic about doing it. And so I thought, well, maybe this means that this is an opportunity for me to think about doing something different. And I stepped away and had a great experience returning to Northwestern to provide services as a director there. I missed it so much. The DuPage Health Coalition is really unique. It's a gem. The patients, the team that we have here. I've been here for almost 20 years, and I am the third longest employed team member. There are two people who have been here longer than I have, which is really remarkable. It's because it's a special place to work, and it's special work to do. So I just found that I really missed it. And in the missing, I was willing to be brave enough to try to put my stake in the ground and come back as its leader. It turned out that the circumstances supported that, and they still had need for someone to come in as president. And so I returned back in 2015. And 9 years later, I'm very, very grateful that it worked out the way that it did. But it was an important lesson for me. I think I was not as confident as I could have been about my capacity to lead the enterprise. And I think I thought that I had to do it the way that Dick did. And it turns out that's not the case at all. I had to do it the way that I do.
You would do it.
And in doing that, when I returned, we had one program, again, hugely important to us, our Access to DuPage program. But over the intervening years, we've stood up almost a dozen more. So it's really been a fruitful period of growth for us here at the Health Coalition.
So I'm curious, Kara, if you can go back 10 years before you left, and give yourself a message, what would that be?
Oh gosh. It probably has to do with having more faith and confidence in your capacity. That
Yeah.
when we're presented with opportunities for growth, we should lean into them, and that it also is probably to give myself some grace to say that rather than trying to fill someone else's shoes, I
Mm,
should rest securely in the knowledge that my own shoes work just fine, and I just need to walk in those.
sure. And you don't, I mean, you already had 10 years experience and you were the number two, but I could see how the confidence can shake. I mean, almost I hear this a lot lately for some reason. I don't know if it's just on TV shows or what, but the imposter syndrome.
Oh, live and well.
Yeah.
Yeah,
Right.
absolutely, absolutely.
That takes a while to
And
go away.
yeah, it probably doesn't go away.
Yeah.
It's interesting that you can both hold an imposter syndrome and have awareness that the truth is that you're doing just fine. The fact that those two things can live rent free in your brain at the same time doesn't quite make sense. I know that we're a successful organization. I know that we do good work, and I still struggle with imposter syndrome. I think the idea is that you just have to feel that fear and then do it anyway. No.
I love that. I love that. Yeah. Um, Certainly diminishes, I think, as time goes on.
I
But
hope
in your
so.
case, you're constantly launching new programs and services. And then you have that collaborative model. So I could see where it's one of those things that doesn't go away, I guess.
Well, that's part, but that's honestly part of what makes this such a great job. It's probably also why I returned. We this is a community where if you have what we've learned is when we identify a need, and we have sort of unswerving faith that we have the capacity to fulfill that challenge. We Good ideas get funded, and you find the resources to do them. And when they return on the investment with better health outcomes or improved access to care for the community, then those resources continue to emerge. And so we don't. I don't commonly make decisions about what we're going to do as an organization based on what I have funding for. I make decisions about what we're going to do as an organization based on what needs to happen, because I've developed a level of confidence that good ideas get funded. And so if we need to do it, we need to do it, and then we will find the funds to support it. And it just proves itself time and time again. Knock on wood. Obviously we've had difficult financial times just like anybody else. But on balance, I think our healthcare partners and our philanthropic community has really invested in the mission that we have and the way that we do our work. And we also are very lean organizationally. We have a lot of programs. We have 25 employees. You would think, sort of like the Wizard of Oz, that there were a whole lot more people at the DuPage Health Coalition to
Yeah.
do all of these different programs. But the truth is, we're small and mighty. 94% of those funds that we raise go directly back into patient care. Coordinate health access for uninsured patients for about $350 per member per year, which
Wow.
is exceptional when you think about what it actually costs to purchase health insurance,
Mhm.
and coordinate that care. So we really we are careful stewards of those resources, and I think that's also a piece of what has allowed us to continue to persevere all of this time.
I will tell you this, just listening to you, it warms my heart that you have a model, um, typically referred to as a social enterprise model, where
Yeah,
you identify the need and then you go and find the funds.
yeah.
And so often, some leaders find themselves in that trap where they know what the funds are going to be and they model the programs around.
They creep into whatever it is somebody will pay them to do, right?
Exactly. Yeah, exactly.
Yeah,
So I'm going to give a shout out to Rick Lochner because he's a big proponent, as a leadership coach, of the social enterprise model. So
yeah.
um,
It's just
great
it has
company.
just paid dividends for us, and
Yeah.
it also when you sort of lead with mission, and then you find the resources to support that work that you're doing. First, it's a much, much more satisfying way to work. And it's an asset orientation. You look for what is out there in the community that will support your aims rather than sort of dwelling in scarcity. I don't find that to be a very satisfying way to live or work. So we try to cultivate something different when we can.
Nice. Well, I'm going to go back to one of the original statements. You don't do this for 20 years and not learn a thing or two. And in an industry where most presidents or executive directors, have a 5 to 7 year stint, there have, I'm sure, been so many challenges and successes and things along the way. I'm really interested to just hear one story from you about maybe a huge challenge that you overcame or solved in the last 20 years.
Well, there's plenty of those. One example would certainly be the economic distress of the early mid 2000s, the aughts, I guess.
The 2007 housing crisis.
Yes, we found ourselves. Our enrollment in Access DuPage increased by 50% in a period of months. Because that economic crisis precipitated so many job losses, and people found, and this was pre-ACA, so there wasn't the safety net that we have today to ensure that people had access to care. And we had a budget that did not anticipate that we would have 50% growth in our program enrollment in a period of months. And this is a great example. We just kept our doors open, and we just said, whoever needs our services, whoever qualifies for our services, we are going to enroll them, and we will figure out how to pay for it. We opened a line of credit back then because we didn't have the kind of financial reserves to ensure that we were going to be able to sustain that effort indefinitely. And it's funny, we've never actually drawn on that line of credit, but we keep it open today still, 15 years later, just in case.
Yeah, nice
thankfully, we're in a much better financial position. The other example would probably be COVID. All of us, every single one of us, had to pivot dramatically and quickly when all of a sudden, our worlds shifted on their axis. But the patients that we serve were really disproportionately affected and harmed by COVID. They didn't have the luxury of being able to shelter in place. They didn't have social distancing capacity. They were oftentimes still working in unsafe working conditions. It's an expensive place to live, DuPage County. So many of the families that we serve are doubling up or tripling up and living in relatively crowded conditions, which also increase the likelihood that COVID would spread amongst their families. And as we know, COVID disproportionately impacted people of color and immigrants, and those are the families that we are oftentimes serving at the DuPage Health Coalition. We had to figure out how to work remotely. We had to figure out how to stand up COVID vaccination efforts, COVID testing efforts, how to ensure that the families that we served who didn't have health insurance could still get access to the care that they needed, the PPE that they needed. And we had to do all of that working from our living rooms, just like everybody else. And I couldn't be more proud of the team here and the work that they did. It was just extraordinary. And it was really just in service of making sure that we were doing everything we possibly could. I tell people that in many ways, I'm exceptionally grateful that I worked at the Health Coalition during COVID-19, because I think it would be much harder to feel like there was nothing you could do, to feel helpless in the face of the pandemic. And we knew that there were things that we could do. We couldn't solve the problem, but we could find a lot of meaning in what we were doing every day. And I feel like that is a better way to soldier through a crisis, to be able to feel like you're doing something that makes your lives or somebody else's life a little better, rather than having to just sort of live in the anxiety of helplessness about it.
Yeah, well said. Well said. I feel like I have so many more questions for you, Kara, and I know we're running out of time, but let me just ask this because I'm just curious.
Yeah,
Funding is always a question I have in the back of my mind.
sure.
You did mention hospitals that contribute
Yep.
and whatnot. I'm curious as to the funding model, though. Is it a large percentage of individual donors, or do you have funding from the state or county?
We receive a little bit of public health funding. We do receive some state funding that really only started during COVID-19.
Hmm.
Sort of health equity funding increased in response to the fact that we were seeing such disproportionate harm. And so thankfully, Governor Pritzker has included free and charitable clinics in the state budget in the last several years. And we are actually the largest free and charitable clinic in the state of Illinois.
Oh, wow.
Little known
Okay.
fact. We are a clinic without walls. We don't, the care that we provide is out in the community at different doctor's offices rather than a physical location. But so we are the recipients of some state funding. Individual gifts are certainly an important piece of the way that we operate, but they're not the majority of our funding.
Hmm.
The hospitals, philanthropic donors, foundations, the state, and then individual giving. We don't do events. That's certainly an important way that many nonprofit organizations fundraise.
Sure. I'm just
But
smirking because there's so many events.
there's a lot of them. There's a lot of them, and they are time and staff intensive.
Yeah.
So while I attend many, we don't host our own. We have prioritized doing other kinds of fundraising instead.
Oh, nice, nice. Wow. All right. Well, maybe we'll do a part two, I think, because I feel like anybody listening to this is thinking that we just kind of scratched the surface on the different services that you and your team,
Yeah.
DuPage Health Coalition provides, and much needed resource in the community. I'm kind of glad to hear that the number of patients have gone down to around, you said 6,000 a year?
About 6,000 in our Access DuPage program, about 1,000 in our Silver Access program, and then we have a host of other programs and services in addition. To your point, it would probably take much longer than we have to talk about all of them. But they are all focused on the idea of improving health access for low-income, uninsured, and underinsured residents of the community, and also addressing existing health disparities with one resource or another.
Nice. And do you have a sense? Sorry, I got to ask this. Do you have a sense of the percentage of unmet need, or is there even such a thing in DuPage County because you exist?
No, there certainly is. Yeah, I mean, probably there are people, in fact, absolutely, there are people that need our services that may not be aware that we exist, and that's
Okay.
the tragedy. That we are both that Silver Access program, that Access DuPage program, our DuPage Dispensary of Hope. We don't cap enrollment in those programs. We will enroll anyone who qualifies right now in any of them. And I know that there are people that would benefit from the resource that simply haven't encountered the person to tell them that exists.
Okay.
What
So
we
if there is
try to
none,
do, yeah,
if there is an unmet need, it's because they're not aware of your organization.
I think so. I think so.
My
And
gosh.
so this is why I appreciate the opportunity to speak to you or to others, just to increase the likelihood that somebody is able to link up to the services that they need.
So again, sorry for this. We're going over time, but I can't let this one on the table, leave on the table. And I'm trying to figure out how to articulate this, but how of the patients you have,
Yep.
the majority of them find you how?
Well, we try to work really closely with our community partners to ensure that they are a resource, and then of course word of mouth as well. But whether we're going out to food pantries or faith organizations, a number of school districts have information about our programs and services on their websites. We have an active social media presence. We also have enrollment agents for our programs that are based out in the community. So rather than completing all of the applications for Access DuPage at our office, we prefer to set up enrollment agents out in the community so that when a patient comes to the township or the health department or DuPage County Community Services or a homeless shelter or a domestic violence shelter, they have all of those organizations have the capacity to complete an application and submit it to us so we can get somebody enrolled. We also ask our hospitals and our discharge planners and all of those folks to be ambassadors for our programs and refer people to us as well.
Awesome. That's great. I am going to be respectful of your time and just thank you for being a part of this.
Well, it was a pleasure. Thank you very much for the opportunity and for this podcast, sort of shining a spotlight on organizations like ours. We really are great.
DuPage Health. I think you're the first person I talked to that said that if there's an unmet need, it's because they're not aware of you, and if they are aware of you, you're going to enroll them.
That's what we want. That's our plan.
Great. You're the first person to actually say that, which is nice, because I'm heartbroken by some of the other podcast leaders that are just, there's 51% unmet need, and we don't have the resources, and we can do the best we can.
We just we figure that we will find the resources, and that's our commitment.
Nice. Well, any parting thoughts for our listeners out there, Karen?
No. I again, it was really a pleasure. And if you know somebody who would benefit from any of the services we talked about, please have them give us a call.
Any healthcare related services for primarily low income, underinsured?
Yeah. Our door is probably the right door. We can help people to enroll in the health insurance they qualify for. We can help them to pay for the health insurance if that's the challenge. And if they don't qualify for health insurance, we can help them with one of our other programs.
Everybody deserves quality health care.
Everybody does.
Awesome.
Thank you, Paul.
Thank you. Till next time, everyone.
Okay. Take care.
Thanks for listening to the Mission Matters podcast. We'll see you again next time, and be sure to click subscribe to get future episodes.